Hey, Xander Holt here, the primal sex expert. And today I'm going to talk about shockwave therapy for erectile dysfunction. How LIST supercharges erections even if ED drugs fail. In this video, I'm going to talk about this amazing technology of low intensity shockwave treatment and how it can greatly increase your erections. And I'm also going to talk about how treatment's done, and I'm going to show you how you can even do it yourself. And as an added bonus, in a few moments, I'm going to show you how you can greatly increase the results of LIST treatment. So, before I actually get started, I'm going to let you know I'm going to demonstrate part of this on a dildo, a prosthetic penis. So if you don't want to see that, you might want to exit the video. For the rest of you, let's talk a bit about low intensity shockwave treatment. It's been around for a long time. They started using it in the 80s for kidney stones, breaking up kidney stones. So we have a lot of research behind this, showing that it's both effective, safe, and it's been used on lots of people. There's lots of research on it. Now back in 2010, they started using it for erectile dysfunction. So we have about a decade's worth of research on this. And once again, it's been shown to be very safe and effective. So, let me show you how this is done. So, first of all, let me bring out this device. This is called the Phoenix. Now, up until this point, this came out very recently. You had to go into a clinic to get this done. Because these units, unless you want to buy one yourself, but they're $10,000 or more, like a Gainswave unit, for instance. Where this unit, this is the first home LIST unit that has the exact same energy signature as a Gainswave unit. So you can actually do this at home now for a fraction of the price. But keep in mind that what I'm going to show you in this video will apply to any good quality LIST device, such as the Phoenix. Okay? So what I'm going to show you first of all is how a treatment is done. So typically what you do is you take your unit and you go down various lines of the penis. Okay, first of all, they put on a water-based lube or they put on ultrasound gel. And you make these little lines. It goes on the top, it goes to the side, on each side, and then on the bottom. And then when you actually do this, what happens is you're breaking up microplaque in the penis. So the blood vessels can get and do get, as we age, little bits of plaque in them, little hard deposits, which makes it very difficult for blood to flow freely. And this is really important in the penis because some of those blood vessels are really, really small, these capillaries, where only one red blood cell can go through at a time. So if it's blocked, you're just not going to get the same kind of erection that you get if it's not blocked. And that's one of the things that low intensity shockwave treatment does for you. Another thing that it does is it actually stimulates what's called angiogenesis. So when these these sound waves come out, they cause a release of a growth factor that causes new blood vessels to be formed. So you actually get more blood vessels into the penis, which makes it a lot easier to get erections and for them to get rock hard because there's lots of blood flow in there. And I've gone through 9 of these treatments so far using the Phoenix. And I can tell you from experience, it definitely gets it more hard and easier to get erections and more spontaneous. And I'm 52. So as well as that, I've also noticed increased penis size with LIST treatment. So I highly recommend it. Now, I want to show you something as well. Another thing this is great for is a lot of guys suffer from what's called venous leakage, which means that they can get an erection, but it goes down very quickly because there's certain veins in here that have to be clamped down in order to keep the blood flow in the penis. But when those veins get compromised, they start to leak, and it makes it very difficult to maintain an erection. Well, you can use, like the Phoenix for instance, and bring it to the base of your penis and work around the base and get those vessels and greatly improve venous leakage. Also, it's really great for a curved penis, or a penis that's curved like mine, or also known as Peyronie's disease. You can use it for that as well. I'm actually going to address that in the next video I'm going to make, where I'm going to talk way more about curved penis, whether or not you want to keep it or not, and how to get rid of it if you don't want it. Now, one of the things I really love about low intensity shockwave therapy is that it actually addresses and fixes one of the main causes of erectile dysfunction, and that is blood flow in the penis itself. And it doesn't do it temporarily. It breaks up the microplaque and it builds new blood vessels. Whereas ED drugs, just temporarily allow more blood flow to go into the penis. And they have lots of side effects. Headaches, face flushing, stroke. I got asked if the low intensity shockwave treatment can cause stroke because it breaks up the plaque. The answer is no. There's been no documented cases of that whatsoever, and this has been around for over a decade. And that is because it breaks it up so finely. Whereas with ED drugs, you actually do have a risk of that. And you're not addressing any of the source problems like low intensity shockwave therapy does. Now, what do treatments look like? I just showed you what it looked like on the penis, but typically what you want is at least 6 visits. That's what they recommend, or 6 treatments. If you got a Phoenix, you don't have to make a visit. You just do it at home. But that's the minimum. Although I found a study that was done in 2017 where they did 5 treatments, and there was a huge increase in erection hardness from the guys that participated in that study. So it's not necessarily going to take that many, but really for some guys it takes even more. And what they recommend is that you do twice a week for 3 weeks, see how it goes, and then if you're going to go another round, they recommend you wait another 3 weeks, and then you start twice a week for another 3 weeks for 12 visits. Some guys will take 6, some guys will take 12, some guys will take 18, and it does tend to work better for guys who have mild to moderate ED instead of severe ED. But there's other things that you can do, like what we do in Rock Hard for Life, to address all kinds of other issues, because the low intensity shockwave therapy, it breaks down that plaque and creates new blood vessels like nothing else. So blood flow in the penis, it's got handled. But you need blood flow going to the penis as well. You need optimal hormonal levels, testosterone levels, dopamine sensitivity. There's a lot more to erections. But this is a fantastic tool to really, really address one of the major issues of erections. And to address the rest, when I talked about blood flow to the rest of the body and the hormones, if you'd like, I've got a free 9-part video series that you can opt into, and it also tells you a lot more about the Phoenix if you want to learn about this and even possibly purchase it. But the 9-part video series is free regardless. So if you want to check that out, it's going to teach you how to get blood flow to the penis, in the penis, as well as increasing your hormones and decreasing your anxiety level, all that great stuff for free. All right. I hope you really enjoyed this video. Please like it. Please subscribe to the channel. And in the next video, I'm going to talk about the curved penis, like I got, like a lot of guys got. And I'm going to talk about, is it a good thing? Is it a bad thing? Should you get rid of it? Should you keep it? And if you do want to get rid of it, how to do that effectively. All right. I will see you in the next video.